Whatever we can do to prevent a stroke is my passion in life. If I can prevent one person in this group from having a stroke, that's what I get. The whole purpose of this lecture is for you to understand what you can do to prevent or diagnose a stroke and what can we do after someone has a stroke. So, it is a brain attack. It's preventable and treatable. So the main thing is we need to reduce the risk of stroke, recognize the signs and symptoms of stroke, and respond immediately by calling 911. So that's the basis of the talk. Having said that, I have questions for you. You see this picture, you see the next picture, you see the next picture, and the following one, the following one, the following one, and you know I showed you the 7 wonders of the world. Right? So my question to you is, what is the organ, do you think, helped you to understand this phenomena? That I showed you something, you remember something. Someone may say, oh, I don't remember that, but I know the Taj Mahal or I know the Great Wall of China. So what was the thing what organ in your body helped you to do this?
Brain.
Right. Because your kidneys didn't do this, your heart didn't do this. The one which told us, you saw it, you went into your memory store bank, and you got the information. Now you are saying what it is. So this is a unique organ, because this area of this multiple connections, if you start from here, you can stretch up to 447 miles of neurons. So you're talking about San Francisco and anyone's brain. That's unique. You can't have this organ replaced. You have heart transplant, lung transplant, kidney transplant, liver transplant, any transplant, even skin transplant, but not brain transplant. You can't. And this is the same reason. When the brain is dead, even if the heart, lungs, kidneys, everything is functioning, we declare the person dead. We don't wait for the heart to die, we wait for the brain to die. Because this is an irreversible damage which is sustainable for a person to live in this world. So that's the reason this is the organ of being human. If this is not working, doesn't matter, the rest of working is not. You are not here. The brain has uniqueness. Although we have the Republicans and the Democrats, we have a left brain and a right brain. We know that. But they don't work in wherever they're working. Our brain works there. The left brain does specific functions, and you know that we are all crossed. So the left brain controls the right side of the body, the right brain controls the left side of the body. But having said that, there's a uniqueness of the left brain. The left brain helps us move the right side of the body, but it also helps us with our speech, with our understanding, with our mathematics. So there are specific unique functions of the left side of the brain versus the right side. The right side of the brain tells us where we are. So when I close my eyes, I put my hands up, I know my right hand is here, my left hand is here. That's the right brain telling me. On the other hand, if I had a problem with the right brain, I would only feel this side, I would not feel anything on the left side, but I would feel only on the right side because we are crossed. So that's the uniqueness of the right and the left brain. So every bit of the brain tissue is working in doing these unique functions. So people always say, why is this rah-rah thing? Why is that you want to be so fast and furious when you're having a brain problem like a stroke? And the reason is simple. This is the reason. Every minute, we are losing 2 million nerve cells when we are having a stroke. 2 million. Similarly, if you say that, what do you mean by how much does it tell us in an average what is happening when a stroke happens? You are losing around 4 years an hour. It's amazing. So we have to identify, we have to treat it as fast as possible. And that's the reason this is the slide you remember. If you don't remember anything of this talk, I have no problems. I don't take it personally. But this is the slide I want you to remember. each minute you're losing 1.9 million brain cells. Each minute. So time is of essence. We need to get to a place where they can identify and treat this as soon as possible. So first thing is understanding stroke. So remember, it's a brain attack. Still, I go and ask my patient, so what did you have? Oh, I had a brain attack. Well, no, that's not where the brain is. That's the heart. The brain is up here. Brain attacks doesn't have pain. Sometimes they have headaches, but not most of the time. So that's the reason people don't come to the attention, because they always think, oh, I must have slept wrong. Okay, you must have slept wrong. You woke up at 7 o'clock in the morning and not moving one side, and with a droopiness of the face and speaking something a little slurring, and you can think, yeah, I must have slept wrong. But even if at 10 o'clock this is still continuing, there's a problem, right? I mean, people sleep wrong and then they get better. You are not getting better. So that's the reason it's very important to understand that the brain is under attack. Like a heart attack, this is a brain attack. It's still one of the leading cause of death. It's the 5th leading cause, actually. Stroke occurs in every 40 seconds. And it's a huge impact. It's 800,000 strokes a year. 800,000, near about. And women are more prone to have strokes because the longevity of women is more than the men. Similarly, African Americans have a huge impact of stroke because of their risk factors of high blood pressure, diabetes, obesity, and smoking. Hispanics have a higher incidence of strokes than the Caucasians, and part of it is because it's cultural. Sometimes, as culturally, we don't always think bad things, right? If someone's not talking, oh, maybe he's tired. No, he's having a stroke. So that's the thing which we have to get across. It's a huge cost. In 2010, it was $73 billion for taking care of stroke patients. And this is the slide which I take it very dearly. Only 50% gains functional independence. So the rest 50% is dependent on someone. 20% is institutionalized in 3 months. And it is a social disease because now you're deprived of the human elements of being a person. You can't see, you can talk, you can take care of yourself, you can't move one side. Someone needs to be around you all the time because you're falling and tripping. So it's not only a disease that affects you, it affects the whole family. So now someone has to be there to take care of it, or you have to be institutionalized. So it's a social disease. It's not only a disease of the person anymore. So what is stroke? We say stroke, stroke, stroke. Well, when a blood flow to the brain is interrupted, so there is a blockage of a blood flow to the brain. So that area of the brain which was receiving the blood from that freeway is blocked, or one of the blood vessels burst. So these are the 2 varieties of stroke. One is the clot type, where the clot comes in and causes the problem, or the blood vessel bursts. So this is the one which is called the ischemic one, where the block came in, and you can see the clot here. So there's no flow in this blood vessel. So the clot came from somewhere, either from someone's neck or from the heart, and it's down there, and so there is nothing going on. And this one, the blood vessel burst, but the ischemic one, which is the clot one out here, is the most common type of stroke that we deal with. This still is there in 15% of the cases, but we will talk about it. So this is what happens. This is what happens when you have someone's having a stroke. So this is your normal brain, this part. So this is one of the blood vessels going in. This is one of the other blood vessels going. You can see a clot came in, and this is the thrombus. And once it came in, there doesn't have any flow on this area. On the other hand, when this area is going in, there is a trickle of flow in this area. But the thing which you have to note is that when you don't have any blood flow in this area, the immediate cities of this freeway is not getting any blood. It's dead. So this part is dead already. But this is the part, you can see the grayishness, that's the part which will be dead if you don't take care of this problem. So from this small part, it will be a huge part like all the way. So that's the reason that it's essence that you get treatment immediately as soon as possible. Because this part when dead may cause you a little bit of slurring, a little bit of weakness. So you still hold it up, but it goes in down this. But if this whole thing goes in, you're talking about not able to move or not able to talk at all on the right side. So that's the difference. We don't target our treatments in this part. It's already dead. We target to save this part. That's the goal. What causes stroke? You can see that there's a clot came in, and then everything is nothing flowing here. The other arteries are going all the way with red blood, but this one doesn't have any blood. But on the other hand, it's a backflow, so you're not seeing the red. So this is how it starts. When we were in our teens, the arteries looked like this. You can see through and through. You can see the arterial walls, very nice, and this is from the side, and you can see the beautiful arterial wall, and you can see that there's nothing in between. After years of hamburger, fish fries, name it, burritos, tacos, cheeseburgers, this is what happens, okay? So this is the same artery wall. Remember this one? And look at this one. All this junk has made this flow going through right only here. So from here, which you can go the whole thing, now you have to really crawl through, right? And this is what it looks from the side. So this is the hole through which the blood is going. So it's not too much later that this whole thing will clog, and then we have a problem. So that's one thing. And these are some of the clots which we have taken out from people's brain. You can see it's a huge clot. And this is not something which you see on a day-to-day basis. But when this happens, it's really dramatic. You take the clot out and the person starts moving that side. It's really dramatic. The other type, which is the 15% of the cases, we have this bleeding type of stroke. And of all the risk factors, the number one risk factor for this type of stroke is high blood pressure is the number one cause of this type of stroke. The blood pressure is so high that eventually one of these small vessels burst. And it's not like what happened yesterday. It has been happening over years. And this happens I have 42-year-olds which are like this. I have 82-year-olds which are like this. So that's a must, that your blood pressure needs to be controlled, because this is what eventually happens. The white thing is a bleeding in the brain. And once you have a bleeding in the brain, it's done. There's no way for me to go and take the blood out unless your brain only stops the bleeding. So this is something which is absolutely preventable, and we'll talk about it, what to do. So that's called the hemorrhagic stroke or hemorrhage. So what are the risk factors of stroke? There are two types. One is modifiable. That means it's under my control. The other one is non-modifiable. It doesn't matter if I control it or non-control it. I'm stuck with it. The modifiable thing are few. Number one, high blood pressure. High blood pressure needs to be controlled, period. It does not matter how bad you feel, how you feel. You have to work with your doctors or primary doctors to get this under control. Cholesterol, yes. Cholesterol problems are important. People who have atrial fibrillation, where the heart is doing this, many people have it, and this is what happens when the heart is doing this. It's churning the blood. Generally, the heart is pumping like this. So every time everything is normal, but once the heart starts doing this, it churns the blood, forms small clots, and that's when it showers all over the place, and that's where one of the risk factors for stroke. And those are the people who need to be on blood thinners, period. Diabetes, smoking, we'll talk about it. Carotid disease, and if you have a history of a stroke or mini stroke in the past, your risk of having a stroke increases 10 times. So these were the modifiable. That means hypertension is under control, high blood pressure, diabetes, smoking, these are under your control. So this is not under our control. If your family history has increased risk of stroke and heart attacks, your risk of stroke and heart attack increases. That's period. So we couldn't choose that. Prior stroke, That's not under control. You already had a stroke. So it's not under your control to go back and erase that from your credit card. It's already done. So that's his risk factor for us. Females, as we talked about, are more risk of having stroke. Race has a problem. African Americans have higher risk of stroke than anyone else. And age is a big problem. As we get older, the blood vessels become more and more narrower. The blood vessels become more and more tortuous, so the risk of stroke increases. This is a graph. The red one tells you the higher we get, so you can't see these things. The more you get towards, this is 75 to 80, is 80 to 90, the risk of stroke increases significantly, both in females and males. The males actually take over towards the end. The red is the male and the ash color is the female. So that's the one which the more we go up, the risk increases significantly. So these are the risk factors we already talked about. Yes, inactivity is important. We'll talk about what to counter this. But one of the things which is a dearest slide to me is this is a slide which tells you what's the risk of high blood pressure and versus any other risk. This is your risk. So if we took care of your blood pressure very well, we can prevent 350,000 strokes after 800,000 strokes that happens every year. So that's as important as blood pressure is. So what are the warning signs? Sudden weakness and numbness of the face, arm, or leg. So if all of a sudden someone is having one side weakness, don't think you slept over it. Call 911. That's the thing. If you have trouble seeing in one or both eyes, so you all of a sudden you're not seeing half of the visual field, or all of a sudden you can't see at all of a sudden there's a vision problem, we have to rule out a stroke until proven otherwise. So sudden dizziness, as we get older, the imbalance is there. So you bend over and come up, oh, right? Yeah. That's okay. It's not okay, but you don't fall, or look up and then you're like, that's not okay, but it's still okay in a way. It's not a stroke because you have had it. But all of a sudden you're like, you can't stand yourself, you're seeing double, you're having slurring of speech, you're seeing double. That's a sign that it's not your regular dizziness. Trouble walking. If all of a sudden you were walking fine and then you can't walk, because you're ataxic, you feel like drunk, that's a sign of a stroke. Trouble speaking. Like, I can't bring out the words. I'm talking something which is completely gibberish. That's a sign that something's happening. And numbness and weakness of the body, which people mostly come to you in the ER and stuff, because that's devastating. You can't move one side, so it's not rocket science. Now, headaches. Now, many of us, including me, I have headaches. Headaches come in sometimes. When I didn't drink my coffee, I drank my coffee. Days when I, going out with my friends and a little, wine here and there. Next day I may wake up with a headache. But if you suddenly feel that someone hit you with a baseball bat, which is I describe to my patients, and that's what I exactly describe. It's like thunderclap headache. Someone all of a sudden hit you with a baseball bat. If that's the headache you have, don't call your neighbor or your doctor, call 911. Because something bad has happened. So this thing is very common till today. We all call our neighbors. Neighbors are great, but not when you're having a stroke. 911 is your best neighbor. So this is what a facial droop means. That means one side of the mouth is working. Remember, our muscles are supposed to make the smile good. So that one side, but one side is not working, the other side is working. People always say, he was crooked on this side. That's the normal side. The not crooked side is the abnormal side because he can't pull the muscle, he or she. Similarly, the arms, as you can see, it drifts on one side. That's a sign that something is happening. And the speech definitely is a problem, so you need to take care of it immediately. Again, going back into this plot, so someone is having a stroke like this with a big clot. So what are the treatment options? So we have within the first 4.5 hours in some cases, and 3 hours in other cases, where we have a medication called TPA, which is a clot-busting medication. Now, if that doesn't work, if a big stroke like this, not only we have to give the medication, we also have to go in and take the clot out. But that's the reason time is of essence. You cannot, once we reach that 4.5 hours plus, there's nothing for me to do other than medical management. So that's the reason you have a treatment. It comes with a cost, but still you have a treatment. For the bleeding type of stroke, you either need to, if it's from an aneurysm, we either clip or coil aneurysm, and it's a blood pressure management. So this is what we say as a clot buster. It's given in the IV. It works. 30% of the people, when they get it, 30% of people will go back to normal. 30%. Out of 100 people, 30% will go back to normal. 30% of the people who come in will be better than what they came in. That means independent in the activities of daily living. 30%, nothing will happen. The medication won't work. And this is the slide. This is the slide we talk about. The earlier you treat, this is the benefit. The earlier you treat, see the 90 minutes? See that, and the harm. Because out of 100 people, 6 of them will have a bleed with this clot buster. And unfortunately, that's the nature of the game. So when people always say, oh, you know, I'm so worried about the 6% bleed. Yeah, it's true. I'm worried too. But you have a 30% chance of getting better. The other side of the story is that you have that 6% chance of bleed, or you're like this, not talking, slurring of speech, drooling on the right side of the face for the rest of your life. Choice is yours. But the benefit outweighs the risk, because 8 of them who will get treated will be not disabled, 3 of them will improve, and yes, for every 100 patients, 32 will be benefited and 3 will be harmed. That's the goal, because it's a clot buster. You're giving the medication, you're expecting the clot to bust, but it's also a blood thinner, so it can have risk with the bleeding and stuff. How do we prevent stroke? First, know your blood pressure. It's very important, and we have talked about it. To me, well, we'll go through it. I have slides, I think. Atrial fibrillation, if you have atrial fibrillation, you have to take care of it with a blood thinner. Not aspirin, not Plavix. Those are different blood thinners. Atrial fibrillation, you need to be on the Coumadin, Xarelto, Pradaxa, etc. If you smoke, stop it. If you drink, we'll do it in moderation. Well, now I'll talk to you about a little bit in details. Know your cholesterol numbers. We'll go through it. And if you're diabetic, follow the thing. Exercise daily, low sodium salt, and we go over these in details with each of these. Blood pressure. Regular blood pressure check. It's very, very important. Your blood pressures at least have to be 140 and below. I prefer nowadays to 130 and below. They say 120 and below, the higher number. But 140 and below is a must in all situations of life. That's a must. Cholesterol. Remember, HDL, which is, you see in your labs, HDL, H for high. The higher the cholesterol HDL is, the better you're protected. LDL is a bad dude. We don't want LDL in ours too much, but we have to because it's a combination of both cells. We need this LDL to be down, and in patients with stroke or preventing stroke, it should be less than 70. Atrial fibrillation, we talked about it. People who are having this irregular heartbeat needs to be on a blood thinner, not a blood aspirin. When this is happening and you're churning your blood and making small clots, aspirin Plavix does not work. Aspirin Plavix works for the slide I showed you when you have the hamburger and the burritos and the tacos and everything out there in between the arteries. That's when the aspirin Plavix works. It does not work for this thing a problem. Then the aspirin and the Plavix were people who need aspirin Plavix for their type of stroke. Strokes are not like everyone gets everything. It depends on what type of stroke you have. If the stroke is from the heart rhythm problem, this doesn't work. This works, or this works. But on the other hand, if the stroke is because of small vessels from high blood pressure cholesterol, then this is your friend rather than your foe. Sleep apnea is a risk factor for snoring, for strokes. When you snore, and stop till someone nudges you, right? And then you start breathing again. So when you are stopping breathing, your oxygen is going down, going down, going down, going down, till either you wake up, brain wakes you up because otherwise you'll die, or someone wakes you up. So then you start. So when you do that, your high blood pressure comes up, your cholesterol, your diabetes comes up, and it's like the brain doesn't know that you are resting. Brain is active. So when you're supposed to rest, you're fighting all throughout the night to keep you alive till the next day. So this is what happens with sleep apnea. You can see that this is the airway, which is normal, but now it is blocked, and now it is completely blocked. And when you have this, your risk of stroke is around 60%. So that's a high risk. So this is a risk factor that you need to be treated. People are always interested about diet, because whenever we have a problem, we go back to our basics, right? So diet is important. And you know, there's a DASH diet, which is to stop hypertension. And the main ingredient is eat less salt. Now you say, well, that's bland diet. Yeah. Unfortunately, that's the cost. Everything which tastes good has salt in it. That's what the thing is. Fruits are important. Definitely, it's vegetables of different time. And then there's a lot of push for Mediterranean diet, because Mediterranean diet, along with olive oil, is a great thing for the brain. They have done studies mostly in people with dementia and Alzheimer's that Mediterranean diet along with fish and olive oil are helpful for people with memory problems and stuff. And we follow that too for strokes also. And that's the reason we say pass the grain and spare the brain, right? When you have a grain something more, try to get that. And yes, have goodies, maybe a little bit less quality. Smoking. So one of the things is anytime you see a smoker, you have to remind them that their risk of having a stroke and a heart attack is 50%, 50%. And you say, well, but what does that mean? That means that if you are still smoking today, your risk of having the stroke and heart attack in the next 2 years is around 50%. But if you stop it, it will go down in the next 2 years to the point that your risk and my risk will be the same when I'm not a smoker. Now, the other thing is, I don't understand why people will smoke when you live in this type of a polluted environment, when you see all the countries, except for the ones with the green, they have a huge air pollution. This is Los Angeles, ladies and gentlemen. You can't see anything. So it's almost like, even if you're not smoking, you're already smoking a half a pack a day. So on top of that, why would you like to smoke? Tell me, you're already smoking. Other than the nicotine stuff and the high, there's nothing else you're getting from the smoking other than every single day you're doing that. What about activities? Walking half an hour a day for 3 to 4 days is beneficial. If you can do it more. People always say, oh, I started jogging. Well, when is the last time you jogged? 30 years ago? Not a good idea. Not a good idea. It will be only one day you'll be jogging. The next 6 days you'll be calling the doctor to get your medications more. Not a good idea. Start low and slow. Start walking half an hour a day. If you can go do a little brisker, that's good enough. If you can do a faster, that's good enough. But still, you have to pace yourself on what your body can afford. You can't just start. I had a patient who said, oh, after I had the stroke, I started doing, LA Fitness. Well, guess what, where he ended? In the ER, because he passed out. He's on the treadmill when he has never been on treadmill. You can't do that. Everything in medicine is low and slow. Moderation. That's the word I like. But unfortunately, that's a hard thing to do. Similarly for this, right? You say, moderation. What's moderation? You have heard me tell this. One of my patients told me I drink only 2 days. The day it rains in California, The day doesn't rain in California. That means the whole area, right? And what is moderation? You'd start with, how much do you drink? It's like, it's always moving, right? The target is moving. It's like, okay, that's not good. So, wine, a glass, red wine, a glass a night for females, and 2 glasses with males is, now you say, well, you are a male, you are becoming more, discriminatory. No, that's what the literature shows is harmful to you. What about prevention of stroke? It starts with you. That's absolutely on you. And when you have that stroke and come to the ER, and now you have a problem, that could have been prevented. So it's important for all of you to know your medications. When you stop the medication, ask when you're stopping, when can you start? It's important to go back to the regimen. It's not good to stop these medications without a doctor's advice. So be very careful. This is so common for me, and I get so angry. That's where my blood pressure goes up, right? I mean, something could have been done. Now now we are doing medications and treating, and all this risk we are taking for something which could have been prevented. So whenever you are starting a new medication, whether there is an interaction, be careful. Same thing with Coumadin and stuff. People take Coumadin and then all of a sudden goes to a doctor and they say, oh, take this medication. Well, wait a minute. You're taking Coumadin. So there's always an interaction between Coumadin and this medication. So you should be in a position to understand or talk to your pharmacist or to the Coumadin clinic and make sure that there's no interaction between the two. Be vigilant. So having said that, this is a sad story, and I'll tell you the reason. So this is a young person's CT scan of the brain. This is a 38-year-old who comes with a big bleed like this. And you know the reason that the person bled? The person is not hypertensive. She took all the Ds along with it, like NyQuil D, because she was under weather and having cold. So she took all these decongestants over the counter. And her blood pressure shot up to like 210, and she bled into the brain. So what are the things in the over-the-counter is not always safe, mostly with the Ds and stuff. So you have to be cautious and careful. That you say, I take a Benadryl D or Mucomyst D. Those have decongestants. Decongestion increases your blood pressure significantly. So that's the reason you have to be careful with these medications. So the best treatment for stroke is prevention. You want the stroke to prevent the stroke. Everything what you can do not to have a stroke is important. 80% of the strokes are treatable. So we can do things now which we could not do in 1994. We didn't have the clot buster. We didn't have these procedures. So it's a different game changer altogether. So it has changed the whole field. But we need you guys to be more aware of it, have the signs and symptoms known, be fast. That's the main thing. Face, arm, speech problem, call 911. I think, and that's my last slide. Thank you.